Welcome back to my podcast, Care Conversations with Chidi. And today I am going to be discussing types of dementia. Okay, it's important to understand the different types of dementia. Dementia is not just one type, and various types manifest with different symptoms, different signs, different risk factors. And understanding these differences allows the staff in a caregiving facility like ours, Vimsa Home Care Services, or in any other organization, or even the caregivers, the family members and concerned citizens. It helps you to know what type of dementia this person is really having. And because all types of dementia are not the same, this knowledge equips you to identify dementia as a disease, whether you know the type or you don't know the type, okay, and be able to start proper referral or begin to seek early care for such persons suffering with the disease. And so there are four main types that I would like to consider in today's podcast. And the first of them is Alzheimer's disease. Now, Alzheimer's disease is the most common type of dementia, okay? 60 to 70% of dementia cases are Alzheimer's disease cases. This is caused by abnormal protein buildup in the brain cells. So the proteins build up in the brain cells of these persons that have the disease and causes plaques and tangles in the brain, leading to electrical misfiring and all the things that manifest as the symptoms of dementia that you know. And the common features of Alzheimer's disease is gradual memory loss, especially of recent events. So you find people who can remember things that happened so many years ago, but they don't remember what happened a few days ago or a few months ago, okay? And so this is one of the features or common features of Alzheimer's disease. Now you find difficulty in finding words. Someone who was eloquent before, who could speak, who could communicate fluently and clearly, who could hold conversations, suddenly begins to find it difficult to, find the right words to use in a conversation. Now, you also find trouble with planning and problem solving. So their daily routines, simple plans that they could have made in the past without much stress, they begin to struggle to make those plans. You also find disorientation in time and place, okay? People who begin to lose their sense of perception, sense of timing, sense of place, okay? These are some common features of Alzheimer's disease. And now the second type is vascular dementia. And this is caused by reduced blood flow to the brain. This often follows things like strokes and mini strokes, okay? So persons who have had stroke or mini strokes in the past run a higher risk of coming down with vascular dementia. And there are also features of vascular dementia that you might want to just have in mind. Firstly is the stepwise decline, okay? So you could just find sudden changes in the memory capacity of the person, sudden changes, okay? And then usually maybe when you probe, you'll find a history of stroke in such a person in the past. Now, also you see difficulty with judgment and decision making. So they start making poor judgments, making decisions that don't make sense in line with the pedigree of the person and who the person has always been from the past. You begin to discover some changes in their capacity to make decisions, executive decisions, okay? And now slowed thinking slowly, finding it hard to remember things. All of these are features of vascular dementia. And then in some cases, you could find gait and balance problems. So they may begin to stumble, walk with, an abnormal gait. These are some features that you might find, and you might begin to think about vascular dementia in such a person. Now, there's also what is called Lewy body dementia, okay? And this is caused by abnormal proteins deposited in the brain of this person, and these proteins are called Lewy bodies, okay? Now, what are the features for Lewy body dementia? It includes visual hallucinations. Often very early in the onset of the disease, you begin to have this, and then you have fluctuating alertness. So the person has good days and bad days. I saw one movie some years back, I can't remember the name again. If I find it, I'll put it somewhere, where the man had days where he remembered everything, his children, his house help, his family, and he could make proper decisions. And on some other days, he was almost psychotic, wandering and all of this. Okay, and so there's also Parkinson-like movement symptoms. So symptoms that resemble Parkinsonism might begin to appear in a patient with dementia. And finally, there's high sensitivity to certain medications. And which is why it's important that they get care and medication assistance and management at this stage of this disease, so that they do not, overdose themselves or take the wrong drugs and all of that. So you may not want to leave such sensitive decisions to such a person to manage. Now, fourthly, and the final one that I'll be handling on this podcast is frontotemporal dementia. Now, this type of dementia affects the frontal and the temporal lobes of the brain. So the frontal lobe is right here in front, okay? And the temporal lobes are by the side. And now it often occurs early. There is early onset for this. So if you find a person, let's say 45 to 65 years of age, coming down with signs and symptoms of dementia, in the absence of any other serious causative factor or risk factor, you might want to screen the person or rule out frontotemporal dementia for such a case. Okay, and so the common features for this is personality and behavioral changes. Why is this a very significant feature? Is because the personality traits, the personality of a person is often controlled by the frontal part of the brain, the frontal lobe of the person's brain. Okay, and so because this type of dementia, frontotemporal dementia, affects the frontal lobe, so you might find personality changes and behavioral changes. Someone that used to be very tolerant becomes aggressive, becomes moody, fluctuating from a very sanguine, stroke outgoing person to becoming very quiet and introverted. So lots of social filters. They start losing the ability to interact in the social settings. Social settings become a bit disturbing, okay, and they might be unable to cope, socially speaking. Now then you find impulsivity and apathy, a loss of interest in many things. They're just reclined, or they go back into themselves. And then language difficulties are also important to note in this type of dementia. And one thing that a caregiver needs to have in mind is that in some types of dementia, okay, memory may be relatively intact in the early phase, okay, especially in frontotemporal. So the person might be remembering everything, and that throws the general public out, because people are expecting that every case of dementia should start with memory loss. But in this person's situation, his memory is intact, but his behavior changes and he starts becoming aggressive. His wife might even divorce him at this point without knowing he needs support and care, and that this is a disease. And so it's important to have this in mind as we care for people with dementia, as family members, as concerned citizens, as a person yourself. You might also want to check yourself out if you're in this age category and begin to notice some symptoms like this. You may want to reach out to your physician and begin to seek care and support much early, instead of waiting till the situation is out of hand before seeking for care. And I hope this podcast has been able to help you today. And I hope I did not use so many medical terms. See you in the next episode. And thank you. Once again, try to like, share, and subscribe. Okay. We would like to have more of you and to grow our reach so that more people will be informed about this condition and be able to care for those who are suffering from it and give them the life and the dignity that they deserve. Thank you, and see you in the next episode. Bye-bye.